Hi, I'm Share Harlin-Davis, program host for Reid Beside You. And today's episode, we are going to discuss the PACE Center. And today we have Jason Woods and Matt, whoops, and Melissa Gallagher, the nurse practitioner from the PACE Center, and welcome. And first of all, can you just tell us what the PACE Center is?
The PACE Center is the program for all-inclusive care of the elderly. So it is a program that can offer multiple services to ensure that our elderly can stay in their homes as long as they can, but still receive the care they need.
Okay. And also, the first thing people will say is it's the old county market building that
That is true.
looks
True.
tremendously different. Then one of the things I want to introduce, let the audience know a little bit more about you, Melissa, and your duties at the PACE Center.
Okay, so I am serving as the primary care provider at the PACE Center. So when a participant signs on with us, I will be providing mostly all of their care. I do coordinate that with Dr. Anderson, who's the medical director of the PACE Center. So between he and I, we are the primary care providers for our participants.
And you have been with Reid for how long?
It has been 12 years.
Okay.
I actually worked for Reid years ago also when I was going through nursing school. So if you added it all up, we're probably looking at close to 20, but 12 years at this point.
So people will probably know a very familiar face along with Dr. Anderson. How if I was interested in coming to the PACE Center, or if I had a relative, what are some of the requirements?
So they would need to be 55 or older. They would need to live in our service area. We service 6 different counties, so they would have to be within those counties. They have to meet nursing home level of care. So that is figured out through our home assessment. They don't necessarily need to know what all of those criteria are. We can figure that out for them. But that's kind of the starting process for it.
And with that starting process, would I speak with someone, or does
Yes.
someone come and evaluate me?
Yes. So if you were just to call the PACE Center and say that you were interested, which is how some of our referrals come, then Krista, our enrollment specialist, would then come to your house and start the assessment process.
And normally, how long is that process different with each person? Or how would I find what would be the next steps?
So Krista and one of our home care nurses and also an occupational therapist come to the home. They do their assessments. They bring the information back to our team. And if the person kind of passes through those assessments, then more assessments are scheduled here at the PACE Center. So then they would see a physical therapist, a dietitian, myself, social work. We would get them onto those next assessments and go from there.
And what type of services are available?
I
didn't know if you wanted to add Jason come in, or just you, or
Jason can pipe in whenever he wants to. So we offer a lot of services. So
okay.
We have transportation, so we can go and get the participant to bring them here for those assessments. As I said before, there's the dietitian, physical therapy, occupational therapy, social work, myself, nursing. We have home care available. We have recreation available to do activities with them. There's a lot.
So Sherry, just kind of to add to that,
Mm-hmm.
sorry, I have to move the camera here. That's the great thing about PACE. PACE is all inclusive. So when it comes to delivering those services for the individual, it's not just one specialty here or there. It's all different types of services. So we offer a lot of those services right here in our facility. But if the service is not offered right here on site, we do have contracted vendors that we will get the individual to provide those services. So it's vast, and it all speaks to what PACE is all about. We're here to offer that entire continuum of care. We want to make sure that the individual is receiving all of those necessary services. So, generally, if somebody just has Medicare, they can't access the services that are a part of Medicaid and vice versa. The
Mhm.
great thing about PACE is PACE brings Medicare and Medicaid services together all under one roof. And whatever is truly needed for that individual, it goes before our interdisciplinary team. There's no real long, extensive pre-approval process. It goes before our team, yay or nay vote. It's added to their care plan, and then we go from there. So we really are able to provide whatever kind of services are needed for that individual.
And I know there's some changes just due to COVID, but can a person who was interested or their family, could they still have a tour of the facility?
Oh, definitely. We still have provided tours. So most of our staff right now are working from home. So already, I mean, we have a large facility here, 22,000 square feet. So social distancing is not an issue here. But also to kind of cut down on, the risk of bringing COVID into the center. A lot of our staff are working from home, working remotely. But we definitely have staff here available to provide those on-hand tours, because we want individuals to see our facility. We want them to come in and really get a good sense of what this program is before they sign on that dotted line. So COVID has changed a lot of things for us. The biggest thing right now is, for the most part, our day center is we use it very sparingly right now. So, but that's something, once COVID is kind of out of the picture, it's going to become more robust and it's going to become much more active. But if somebody needs to utilize our day center and they're a participant, we go case by case. So really, as far as our services that are offered, that's really the only thing that has sort of changed just a little bit. We go more case by case on that. But as far as tours and the different assessments that are needed to be completed during the enrollment process, we definitely do that all still on site, and we take all the different precautions that Reid has put in place for COVID.
One of the biggest questions I receive in the community is, if I have a relative and I need to go shopping, can I just drop them off at the PACE Center?
So it's not as easy as that. So every individual has the individualized care plan. So in that care plan, it specifies when the individuals will be coming into the PACE Center, if they even come at all. We'll have some participants that won't utilize our day center, but if there's some sort of special circumstances, the family, the participant, they can just let us know, and then we can get that approved or disapproved. But generally, everything is kind of set in that individualized care plan. So if they're set to come in Monday, Wednesday, Friday from 10 a.m. to 2 p.m., something like that, that's generally the schedule that we stick with. But like I said, if there are some sort of special circumstances, we can take that to the IDT. It's just, we can't get a call at 1 o'clock in the afternoon and say, hey, can I drop her off at 1:30? It can't work quite that fast. But we try to accommodate as much as we can because we're also here for the caregivers. We understand that they go through a lot, and they have responsibilities they need to get done, and PACE really wants to step in to add that additional support system for them. So we will do everything that we can. We just have a little bit of limitations ourselves.
Right. On when you were and you say about the day center, can you give me an example of what would happen if someone used a full day services at PACE?
I'm sorry, I didn't hear that last
I
part.
said, so can you give me an example of what would happen? What's a typical day if someone is a participant at PACE, they pick them up and drop them at the PACE Center?
Okay.
Then are there things that happen during the day?
Yeah, we have. So there is no typical day at PACE. That's one thing that we love saying, because it truly is, and it's that way not only for our participants, but for all the employees as well. There is no typical day at PACE. But generally, everything is laid out in their care plan. So as I was saying, if they come in Monday, Wednesday, Friday, or all 5 days a week, or one day a week, regardless, they would get picked up at their home. One of our NCAs will be on the bus. So we have contracted with Livestream, which does all of our transportation needs for us. But our NCA will actually go into the home, help the individual get out to the bus, and then accompany them here to our facility, and the same going home. But once they get here, depending on what time they get here, they will have the option for a light breakfast. We do serve a full lunch, and then also possibility of afternoon snacks if they need it. We try to stick within the care plan that the dietitian has laid out as well. But there's different activities that they will be doing. We have an incredible recreational coordinator, Stephanie Drew, that she has all different types of activities planned, and we have a huge calendar in our day center that will list all those different things. We have a television room, we have a quiet room. We just have so many different aspects to the center that our participants can utilize. So they can come in, they can do some different activities. They can also be seen over in our clinic area if they have a scheduled appointment. We also have PT and OT, physical therapy and occupational therapy here on site. So if they have any sort of appointments with them, they can do those. And then they can go back to doing their different activities or whatever the case may be. So every day is going to be different. Some days they'll have appointments. Some days they're just coming for that social aspect. So here at PACE, we want to not only focus on their physical self, but their spiritual and mental selves as well. So the social aspect is very, very important to us. So we definitely try to meet all those needs here at the PACE Center as well.
And among all those, you mentioned the quiet room. Why would you need a quiet room?
So the quiet room, it's set up with 2 beds in it, and there's also some really cool fountains in there. They light up, and they have different fish or jellyfish in there. They float around. It's a very, very relaxing room. And the reason for that is for a couple different reasons. One, if somebody becomes overstimulated and they just need to kind of decompress, they just need to be off, away from the group or whatever, it's a great place to go in there. And then also, who doesn't love an afternoon nap or something? If somebody gets tired, they can definitely go in and they can have that afternoon nap. Just get away from the hustle and bustle of the day center. But it's a great, great relaxing room. And I would encourage all your listeners, we have a great virtual tour that's set up on our website. So if they go to reidhealth.org/PACE, there is a virtual tour on there, and they will be able to see all the different aspects of our facility.
And they will be very surprised when they see what the facility looks like.
Yes, it's beautiful.
It's beautiful.
Reid spared no, yeah, Reid did a phenomenal job. They spared no expense. They turned this old county market building into a beautiful, beautiful facility.
So I know for so long we were waiting for approval to open, and so we almost anticlimactic by opening as well as being in the middle of a pandemic. What's new since you've opened?
So it's been quite the journey opening during a pandemic. I'll tell you what. We haven't been able to have the big grand opening things that a new business would get to have. We didn't have all the different open houses. We only got one in before COVID hit. So it has been pretty anticlimactic for us. But we are open. We opened our doors November 1st. We started the enrollment with potential participants in October. So things are still pretty quiet around here. Census is still kind of low. We're still trying to get out there. Marketing has been difficult. Everywhere is pretty much on lockdown. But we're plugging away. We have a great team here. And we're all marketers at this point. We're all trying to find those people that truly need us. So things are quiet here, but it will take off. And as soon as things kind of relax with COVID, we're going to have that big grand opening and that ribbon cutting and things like that. So we'll look forward to having the community come out and truly be a part of a real grand opening for the PACE Center.
What can people look forward to in 2021 from PACE?
So it's going to be a great year. I know it is. 2020 has been terrible, and it's been very, very difficult on a lot of people, but PACE is a great, great program. We're all very excited to offer it in this area. Those 6 counties that we touched on earlier, the counties are Randolph, Henry, Wayne, Franklin, Union, and Fayette. So all the different citizens from those counties, we're very, very excited to serve them. We're really going to be able to get this program out there and meet the needs of the community. 2021, I don't have a crystal ball, but there's a lot of hope. So I think the phrase for 2021 is there is hope. And so we're going to get there, and our team here at PACE, we're looking forward to doing everything that we can to give that hope to all the different families in our area.
Are there other PACE centers in Indiana?
Yes. So there's currently 3 now. And if they're interested in where they're at, they can always go to npaonline.org. But they are in Indianapolis. There's one over in Indianapolis and one up in Mishawaka. I did just get word about a week or so ago, but please don't quote me on this because I've only heard it once. I do believe one is opening in the Fort Wayne area later next or early next year. I think they're planning on opening around spring. But with the way that PACE works is you have to have a PACE center that serves your area. So we are the only PACE center here in East Central Indiana. We serve those 6 counties, and it's going to be great. I promise you guys.
And I know we've talked about it before, but we can never explain the referral process enough when we explained how Krista comes. But what happens if maybe your healthcare provider, can they be involved to refer you to PACE?
Yeah, definitely. Anybody can be involved with referring anybody. So we've received referrals from other agencies. We've received them from other departments at Reid. Family members can refer individuals, and the participants themselves or potential participants, they can give us a call if they're interested. The easiest way is to just give our facility a call, and then we will get your information passed along to Krista Gibson, our enrollment specialist. But we do ask, if you are referring somebody if the program is not for yourself, but for a loved one or a client or patient, we just ask that you give them a heads up that you are going to send their information over to us at PACE. So when we do give them a call for the pre-screening, they're not taken off guard. So, but anybody can do it. And also on our website, we do have a place that you can submit your information. And then that information will be sent both to myself and to Krista Gibson, and then we will get a call back. And the way that the whole enrollment process starts is Krista will reach out with a phone call. She'll go over a short list of questions just to kind of make sure the individual meets the base requirements for our program. And then from there, we'll start setting up the home assessments and things like that. So it's very, very easy to refer. Anybody can refer anyone. So if you know somebody that can utilize this program, please give us a call. And right now, things are busy, but they're not that busy, so we can get back to you pretty quick.
Another question is partnerships. And are you a competitor to different agencies, or do you partner with them? How's that work?
So a lot of people do view us as a competitor, but part of my job is to kind of take away that view from people, because we don't want to be viewed as a competitor. I just did a conference call this morning with one of our area home health agencies. They're not a contracted provider with us, but they are an agency in our service area that we're just looking to build partnerships with, because not everybody that we encounter is right for the PACE program. So we need to refer them to the agencies that we believe can assist them. So we've had roughly 40 referrals already. One of those referrals, an individual was only interested in utilizing our day center. They didn't want any of the medical side of it. And with PACE, you have to take on pretty much all those different services. You can't just cherry pick things. So what we did was we referred that individual to the other day center that's right here in Richmond. So we don't want to be a competitor. We don't want to steal anybody's patients or clients. We're just out to work with one another, because especially right now with COVID, a lot of nursing facilities, assisted living facilities are unable to accept other individuals or new patients, so they could utilize us as an option. And then they also have individuals sitting in their nursing homes that, if they had PACE services, they would be able to go home and be reconnected with their environment and their loved ones and things like that. So but we'll encounter people ourselves that, even with PACE services, they will not be able to live safely in the community, which is a big requirement for this program. And so then we would refer them on to the right nursing facility or assisted living facility. So we want partnership. So if you're with an agency, please feel free to reach out to me, and I would love to present to you, your staff, whoever you need to start this partnership.
I know that you've also reached out to like the housing authority for people who might have been, they're getting older, they don't have a lot of interaction with people, then that might, it's been a good mix as well. They'll have someone to check on them as well. So,
Yes.
and another thing is they can look, it cuts down on hospitalizations, correct?
Yeah, the PACE program. So we had a perfect example of this morning with our interdisciplinary team. There's 11 different professionals and paraprofessionals that make it up. So you have 11 different sets of eyes, plus the other staff that's in the PACE Center as well. But we had a perfect example of this during our morning meeting where we have a participant. They were having an issue with their foot, but our primary care physician and our nursing staff had no idea about it. But it was brought up from the daughter, the caregiver, to our social worker. And so our social worker was able to report that to our primary care physician, to Melissa, and to our nursing staff. So now they're able to go from there and try to treat this issue. So it's just a prime example of things that happen out there in the world where, people start developing different things, but they only see their doctor once a month, once every couple months, and they're not always forthcoming with everything that's going on. So here at PACE, we have so many different sets of eyes, so we're able to catch things sooner. That hopefully will cut down on unnecessary ER visits and hospitalizations and things like that. And we can treat those things much quicker to hopefully before they get much worse. So it's just one of those great aspects of PACE. You're truly surrounded by a team of professionals here. So
Let's describe a typical patient.
So there is no typical patient as well, just like a typical day at PACE. There really is no typical. We get people with all different types of diagnoses, whether it's mental, physical, whatever the case may be. So the number one diagnosis in the PACE world is dementia, though. So I guess you could put that as one of the typical. But generally, we have seen just through the referrals that have come in so far, just all different types of issues. So it's generally, it's people, it's families that are having to look at putting their loved one into a nursing facility, whether it's because of some sort of mental issue that they're having trouble dealing with, or some sort of physical issue, whatever the case may be. I guess that's pretty much the only typical thing is they're looking to have to go into some sort of facility. But we're here. We want to help them age in place. We want to treat them in place. So we're going to do everything that we can to help keep them connected with their loved ones in their environment.
Then we're going to flip over to Melissa.
All
And
right.
what would you like people to know about your role at PACE, or just to ensure this, that we know that you're going to safely monitor their loved ones?
So, I guess the most important thing is, yes, when you come to PACE, you are taking on myself and Dr. Anderson, but they can rest assured knowing that, if they see other Reid providers, they can continue to do that. Because we are contracted with all of the other specialties that are housed within the Reid umbrella. So just because you're taking on myself and Dr. Anderson does not mean that you have to stop seeing all of your other providers. The other thing, I guess, would be that, we are taking care of the whole person. So just because you're coming to PACE with, certain issues does not mean that, other things cannot be addressed as well. So, if your problem is mainly physical, we have the capabilities of treating, a whole number of things. So we can get you referred to the right person, or we can take care of it here too.
Great. And Jason, I'm going to flip back over here to you again. What would you like the audience, something we might have missed that the audience should know, either about what you're doing or just PACE in general?
So we've done, I think, a pretty good job of covering everything today, but I will say that we are open. We're ready to serve the community. Myself visited about 70 different agencies last month to get our marketing material out, because we're really committed. We're really interested in building these area partnerships, and going back to the competitor comment and things like that. We don't want to be viewed as a competitor. This is a great program. It's a revolutionary program in the healthcare world. So, PACE, it's not offered everywhere. So we're actually very, very fortunate here in East Central Indiana to be able to offer this program. So I would just encourage the listeners, the viewers, if you have somebody that you believe can benefit from this program, or if you yourself could benefit, please reach out to us, give us a call. We would be more than happy to get our enrollment process set up with you and to be able to offer this, because no longer are the days where somebody can't take care of themselves, so they have to go into a nursing facility or assisted living facility. PACE is another option. And, we want to help those individuals, like I said earlier, age in place. We want to treat them in place. We want to do everything that we can to keep them connected. So, but we also worry about their safety. So if it's not safe to do so, we're not going to bring them onto the program. We will get them to the area agency, social services. We have a social worker on site. And then also Krista Gibson, our enrollment specialists, are very knowledgeable about the different resources in this area, so they will definitely be able to assist if we cannot help that individual ourselves.
Okay. Well, I want to thank you both for joining us today for Reid Beside You. And once again, thank you, Melissa and Jason, for sharing about the PACE Center. And thanks our guest for joining us today on Reid Beside You.
We are an option for long-term care. So individuals, most folks want to remain in their home for as long as possible, and they want to age in place. And we are able to, our program and our services are able to help them do that, remain their independence for as long as possible and as safely as possible in their choice of environment. My name is Ashley Werner. I'm the director of the Reid Health PACE program. My background is I have a master's of geriatrics from the University of Indianapolis. And I come from Medicaid waiver and home care. That's my background. So my passion is aging in place. I'm a firm believer in that, and anything that I could do. Wayne County is my home. I was born and raised here, and was hoping that Reid would just open a program for geriatrics that I could join, and I'm very excited to be a part of that program. So this is home, and so I get to serve my home, my family members, my friends, so we're excited to do that.